we doing today, everybody? Avi Weisfogel. Yes, a little bit hoarse today. Coming to you with today's words of wisdom for working in the world of sleep, but really working in the world of sales. Because let's face it, guys, no matter what, if you are in the world of dentistry, you are a small business owner, likely, unless you're an associate, in which case, take this lesson and use it anyways. You're selling. You're a salesman. You're a business owner. Like it or not, you're a salesperson. So how many people have you treated today that need a crown? I need this crown, or what's going to happen? What happens if I don't get this crown on tooth number 19? Is life over? Is that what happens if I don't have this done? There's not anybody that needs your services, yet you sell it easily. Sleep apnea, on the other hand, comes hard to some dentists. Like, well, I don't know. How can I get this guy to buy this piece of plastic for $7,500? And by the way, that's what your fee should be. Your fee should not be $1,800. How can I get this guy to buy this piece of plastic for $7,500? It looks so cheap, and I'll tell you why. Because it is the only thing you can do as a dentist that will hopefully extend somebody's life anywhere between 5 to 10 years. On average, the net number is 7.8 years of extra life. That's pretty cool. So I know that every crown I did extended everybody's life 0 days. And I know that this is something that is just a wonderful service that you can offer out. Now, what's cool about this is that if you learn sleep and you learn about sleep apnea, you can very quickly become the most knowledgeable person in the room. Doctors, physicians who graduated medical school 10 years ago or more, they just haven't been taught it. So you can learn it and become the expert. If you know something and you're the one who knows more about it than the people in the room, you're the expert, even if you don't know that much. So learn this skill, guys. It's so easy. Any third-year dental student can do an oral appliance. That's simple. That's easy. Learning the sleep of science. Simple and easy. I'll give you a quick definition of sleep apnea. This will be your little lesson for today. Sleep apnea is a breathing disorder that occurs while sleeping. Let's go specifically into obstructive sleep apnea. So obstructive, there's an obstruction. It's blocking. Usually it's your tongue blocking the back of your throat. The airway is like that big. And so if the tongue slides down, right, if you're falling like sleep like this, right, your tongue drops back right over that airway, not breathing. When you're awake, you have no problems breathing. Why? The jaw sits in the proper place. We're using all our facial muscles. Airway stays open. So obstructive, something's blocking. Sleep happens while you're sleeping. And an apnea. An apnea is a stoppage of breath for 10 seconds or more. In order to have obstructive sleep apnea, you need to stop breathing 5 times or more per hour. Lesson of the day, obstructive sleep apnea. If you know that, you actually know more about obstructive sleep apnea than most physicians. And that's just that much. That's the basic definition. Come to a sleep course. They come and sleep courses are taught all the time. At Dental Sleep MBA, we have what we call a preview event. We have those every month. Coming soon to a city near you, right near you. And sooner the better. The events sell out pretty quick. We just had a totally sold out event in Austin. It was pretty neat. We got to see Brandon Hedgecock in action. 7-figure sleep practice. Pretty cool stuff. Obstructive sleep apnea, guys. You guys can be saving patients' lives, at least extending them, and right away, as soon as you treat them, improving the quality of life. This is something anyone and everyone could do. So go for it, guys. Learn how to treat sleep apnea, and remember this. There are a lot of rules. If a patient comes into you in need of a crown, you can just do it. If a patient comes into you needing an oral appliance, there are a lot of things that need to be done in order for you to legally do this. Make sure you take a course. Make sure you understand all the rules. There's like 24 steps or something to turn a dental patient to a sleep patient. Maybe we'll reveal 1 step a day. Anyways, stay tuned for more words of wisdom coming to you from the Dental Sleep MBA program. Thank you for listening.